Again, that was a great start to our conference this morning. Again, want to thank you all for being here. And now it's my great privilege to introduce this afternoon another keynote presenter, and that is Dow Constantine, the elected executive of King County in the great state of Washington. And that's the county, by the way, that encompasses the entire Seattle region. So a major region in Washington for sure. In fact, I think it's the part of the state that represents Dow over 50% of the overall state population, or something quite significant. You know, I was thinking about Dow's presentation today, and it reminded me that you know, a factor that's really heartening about the health and productivity and human capital movement is that it sort of expands and goes across all employer types. Whether you are in the for-profit or not-for-profit world, whether you work for a large, small, or medium employer, whether you are an employer from the Seattle region or a region in Miami, I think we've really started to create a movement here that extends across the employer population. And because at the end of the day, and I think this theme came up in the conversation earlier, it is all about organizational performance at the end of the day. And whether or not, again, you are a mission-driven organization or need 100% focus on the bottom line, health and productivity can make a major contribution to your overall business performance in support of whatever mission your organization has. And it's in that context that we're very pleased, as one of our keynote presenters, to have a representative from the public sector, from government, that has really led the way, I think, not only in Washington, but among counties in that state, and has gotten now a national reputation for their investment, for the work, innovative work that they're doing in health and productivity. And Dow Constantine, again, the elected executive from King County, is here to tell us the King County story. The other thing that I have to say in way of introduction, and Dow and I were talking about that this morning, is that this is a company that has made an investment not only in their own organization and their own workforce, that they're a company that also understands that investment in producing and creating cultures of health at a community level, investing in the reform of the healthcare delivery system, is also an important responsibility for an employer, and where employer leadership is critically needed. And so it's in that context that I'd like everyone to know that King County was really the founder of the NBCH employer-led coalition in the Seattle region, the Puget Sound Health Alliance. And Carolyn Whalen from King County is also here, who is the new chair of the Puget Sound Health Alliance. So again, I'm so pleased to have a company that gets it not only in the context of their own organization, but also understanding community dynamics that can have an influence on health and productivity as well. You have in your program agenda Dow's very impressive biography. I'm not going to read the whole thing, but I did want to read the first sentence of the biography, and that is, since his election as King County executive in November 2009, Dow Constantine has been working to instill a culture of performance that changes the way King County does business and forging partnerships with residents, cities, employees, and other county leaders to craft real sustainable reforms. That, in a nutshell, is the King County story. And with that, it's a great pleasure for me to introduce Dow Constantine. Dow?
Well, thank you so very much. I know most of you can hear this funny buzz in the speaker over here. Are the guys with the AV cards going to be able to fix that? Yes, no, maybe? I can shout if that will help. Probably not. We can hear you. Okay. I'm Dow Constantine. I'm the elected executive of King County, and I'm honored to be invited here today to tell a little bit of our story and to address the 2013 Forum on Health and Productivity. I spend most of my time in one Washington or the other Washington, and it's great to be with you here kind of in the middle in the great state of Texas. Before I jump into my presentation, I thought you might like a little more insight into the length to which I went to become the executive of King County. So you don't need the audio because it's pretty dumb, but you get the basic idea. Either because of or in spite of that advertisement, I got elected in November 2009, and I am now the executive of King County, home to, as was mentioned, Seattle and 38 other cities that resent Seattle for always being used as the shorthand for our entire region. And in fact, several counties that make up a larger metropolitan area and really the economic region that we know today. It is the 14th most populous county in the nation with about 2 million people. And with some 12,500 employees, although down from 14,000 when I took office in 2009. We are the second largest provider of public services in the state of Washington after the state itself. We also have an aging and highly unionized workforce. The average age of a King County employee is now 51 years. And I know how, in fact, I know exactly how they feel. I was in my 40s when I took that chilly swim that you just saw. For a friend from Walmart, we don't have any 100-year-old employees that I know of on the payroll. We do, however, have an 87, soon-to-be 88-year-old bus driver with an excellent safety record, I might add. And I sign hundreds of certificates for employees who are celebrating 30 or 35 or 40 or more years of employment with the county. I'm here this morning to tell you how King County tamed the beast of employee health care, or at least defanged it, and our results have earned national attention. In 5 years, we saved $46 million in health care costs while measurably improving the health of our employees. So here's how we did it. For those of you who are in the public sector, we are a lot like you and like every other government across this county. We've all been deeply impacted by the recession and by the rising cost of health care. That rising cost of health care continues to be one of the greatest financial challenges we have. So the statistics listed on this slide are very familiar to you and on the slides to follow. Common sense tells people that price and quality are linked. And those of you in this room know that in health care, higher quality care can in fact mean lower costs because people are healthier on a day-to-day basis and they're getting the right kind of care, the care they need. We see our biggest opportunity for further cost reductions in improving the quality of health care so that our costs go down. Now, when I took office in 2009, my #1 job, as was mentioned, was to address our financial challenges by making sure the county is running as efficiently as possible and delivering the maximum value for the taxpayer dollar. My agenda for reform included these concepts: developing a culture of performance that changes the way King County does business, embracing new ideas to bring reform to county government consistent with our core values, forging innovative partnerships, especially with our employees, and providing the necessary infrastructure, such as for transportation, critical to building prosperity and competing for family wage jobs in our region, aerospace in particular, as well as high-tech and biotech jobs. So the reform agenda I articulated was then incorporated into a strategic plan, a countywide strategic plan that clearly lays out for the public and for our employees what we deliver and how we deliver it. This document guides our policy and our spending priorities. And wellness has been a key strategy in delivering on two important components of the strategic plan: financial stewardship, building the county's long-term fiscal strength, and a quality workforce, developing and empowering employees. Another key strategy is lean, what many people know as the Toyota production model. We are implementing lean organization-wide as a way to eliminate waste and focus on what gives value to our customers. As part of this process, we use data to continuously improve our programs and our services. Now, lean is a critical part of how we think about healthcare costs and wellness. As you can see here, we are also saving money by using an assortment of public domain clip art in our presentations. Take flu shot. This is about flu shots. Take flu shots as an example. An employee has to leave work to get a flu shot. He or she can spend 2 hours out of the office. That's a loss of productivity. In the second row, someone might choose not to get a flu shot. They save 2 hours by not going to the doctor. However, if that person gets sick, he or she will spend at least 3 days out of work, and then when they return, they might have several days of presenteeism, when they are still foggy from their medications and from the flu. So what provides actual value to the customer? The shot. So for that reason, we brought flu shots directly into the work site, and we have cut the total time to get vaccinated to an average of 10 minutes from start to finish. And you can see our Chief Administrative Officer, Caroline, working feverishly at her desk, not having gotten the flu. You'll meet her in a little while. We have realized great savings from our reform efforts in the area of healthcare. From 2007 to 2011, we saved $46 million in healthcare costs, which helped us to provide the same level of services even with our constrained finances. It allowed us to live within our means. And our employees have lost weight. They've quit smoking. They have sought higher quality, lower cost healthcare. 2,000 people lost 24 tons of weight. 800 people quit smoking, dropping our smoking rate among our employees from 12% to just 7% in that short period of time. We've increased the number of employees who use higher quality healthcare providers, and I'll get to that in a moment. I'd like to add a few notes on the smoking rates for comparison purposes. The smoking rate for all of King County residents in 2010 was 12%, compared to 7% for King County employees. That same year, the smoking rate in both all of Washington State and all of the state of Texas was 16%, and it was 17% nationally. And we, you know, as an aside, we know that our employees are quitting smoking, even though it's self-reporting, because we can see it in the ailments and the treatments we're having to pay for. Dramatic reduction in respiratory ailments that are saving us a lot of money. Let me break down the figure of $46 million in savings. $14.6 million is from improved health, like the savings on respiratory illnesses. $6.5 million is from people shifting to higher quality, lower cost health care at Group Health Cooperative. $24.7 million is from plan design changes. This includes employees making incentive-based shifts to generic drugs, which saved us quite a bit of money, changes in utilization patterns, and negotiated modifications to our employee health plan. We have lowered our costs, and we have done so in a way that is sustainable. We have not just shifted costs to employees, because when we're working in partnership with our workforce, we don't first focus on who gets stuck with the outrageous bill, but rather what we can do together to reduce the total bill. And this is one example of the kind of sustainable financial stewardship that has earned King County a AAA bond rating and the trust of county voters. So, since our Healthy Incentives program started in 2006, we've seen a significant decrease in the cost of health, in the growth in the cost of health care. The annual rate of increase in health care before Healthy Incentives is about 9.8%. And since the program started, even as our workforce has aged quite dramatically with the loss of younger workers due to these layoffs, we've seen that rate decrease to 5.8%. The whole country experienced a downturn that was probably related to the poor state of the economy, but in King County's case, we can show that our reductions were considerably better than what would have occurred without the program. So let's talk about our strategy. It's pretty simple. We surround employees with an environment where quality health care is available, and the healthy choice is also the easy choice. Having created a culture that values health, we then influence the decisions that our people make through the use of incentives. But our reform work in healthcare is not limited to our employees. So here we're, moving from talking about our internal financial health and our employee health to talking about the bigger picture, our mission as a government, our policy imperatives to have a healthy community. This is where we go big. And we're seeking to catalyze change in the public and private sector throughout our region. To drive improvements in healthcare quality around the region, we helped found the Puget Sound Health Alliance in 2004. I was on the King County Council at the time, and during the early stages of the Puget Sound Health Alliance, I was the budget chair, and spent a long time trying to figure out what my predecessor, Ron Sims, was talking about when he wanted us to invest in, spend money on this business, when the rest of us on the county council were trying to get road projects and bus lines in our districts. But in point of fact, he was right. He understood that for King County to succeed internally, we had to succeed community-wide. And the way to do that was to engage all of the major purchasers of health coverage in our region. So the Alliance is recognized by Andy Weber and other folks, the good folks at NBCH, as one of our nation's leading collaboratives. It is comprised of employers and physicians and hospitals and patients and health plans working together to measure and report the quality of health care being provided. It represents more than 2 million covered individuals, which is about half the population of the central Puget Sound area. The Alliance provides powerful leverage for quality improvements, and we have tools such as Evaluate, see with the numeral 8 on the end, a healthcare, it's clever, a healthcare provider evaluation tool developed by businesses and now promoted nationwide by NBCH. The Community Checkup Report, which evaluates and compares provider performance through validated measures of quality and appropriateness of care. We use this trusted, neutral source of information to negotiate value-based changes to our benefit plans with our unions. And I guess I'll talk a little bit more about that. There's a sense that public employee unions, unions generally, but public employee unions are not interested in embracing change. Within the context of our government, our employees, many of the employee groups and individual employees understood that we had revenue constraints, and that to the extent we were able to save money, we were going to be able to have fewer layoffs and continue to provide services. So when I took office, we had a series of very important sort of meetings of the mind around this work, around the voluntary foregoing of cost of living adjustments and other things that allowed us to dramatically soften the impact of the downturn in the economy and reduce the number of layoffs we otherwise would have had to make. And having this data available where we can show our employees objective information about the value that they can get and the help they can provide in making smarter choices, really was invaluable. So the checkup report now supplies information down to the provider level on a number of different conditions. In the near future, we're going to refine that information to give consumers better information about where to find providers who offer value, namely the combination of quality and cost. So this chart seems relatively simple. Actually, if this slide looks confusing to you, and you are the experts, just think how it looks to one of our healthcare consumers. This slide shows the variance in the quality of care, which is illuminated by the Puget Sound Health Alliance checkup report. The checkup report measures the percent of time a provider follows evidence-based guidelines for certain conditions. So green is good. It's for measures above the regional average. Gray shows measures at the regional average, and red indicates measures below the regional average. And so sort of good is to the left, and as we move across, there's less and less green. Being that this is really confusing to the average healthcare consumer, we try to make it easier for them. Here's where we add value, by using incentives to guide them. Guide them to higher quality healthcare providers. Now, higher quality means providers are less expensive and they provide better care for our employees. So the incentives pay off in dollars saved and, of course, in more time at work. So how do we know higher quality health care is less expensive for us? Our own data proves it. Now, I should mention that in addition to Caroline, who's a very sort of linear thinker and very focused on data, my deputy executive, who was one of my rivals in that campaign where I jumped in the bay, is also a 30-year veteran of Boeing management and a former local and state government official. And so he is one of the people who keeps us on task whenever we start getting a little too, let's say, policy-oriented and letting our imaginations wander. He brings us back to the data and the measurables. And that is part of why we've succeeded in this healthcare zone and elsewhere, is because we have enough people who reel us back in and make us look at the numbers and prove that what we're doing is actually working. So Group Health Cooperative, a local HMO that is nationally recognized for providing high-quality, low-cost care. It's less expensive for us than our preferred provider plan. How much less expensive? $4,300 per year per employee, less expensive. When we dug deeper into the data to see what was behind this cost differential, we found it was caused by Group Health's emphasis on prevention and evidence-based care. So Group Health invests resources into making sure its patients don't need to go to the hospital. Group Health does this because they have the correct financial incentives. Healthy people are inexpensive, sick people are expensive, so they do their best to keep the people healthy. But when their enrollees do need help, Group Health provides care that is proven to work. They don't perform expensive but seldom effective surgeries like knee lavage, for example, but our preferred provider plan, in our preferred provider plan, we find many more instances of this wasteful sort of treatment. Because we, as the employer, save money when employees are healthy and when they choose higher quality, low-cost care, we embed incentives in our plan. Again, this is where we take that very confusing chart. We provide incentives in the plan to help direct them to the higher quality, lower cost care that is available at Group Health. We eliminate the deductible and lower out-of-pocket expenses. And this chart shows examples of the difference in out-of-pocket expenses for families between our preferred provider plan and Group Health. So I said that we, the employer, save money. With Group Health, the average annual savings for a family of 4 is $1,336. We provide further financial incentives to people for choosing to participate in our wellness program. So we've just talked about the coverage and the treatment so far, but we're big into wellness. And the higher the level of someone's participation, the lower the level of their out-of-pocket expenses. And here's how it works. It's a product placement for one of our local corporations here. Everyone starts at the bronze level. Bronze level means you did nothing. Every employee who completes the health risk assessment automatically receives the silver level. And you're saying, what, they didn't exercise or lose weight or whatever. We know that this is important because there's solid evidence that making someone aware of their health risks can lead to action. It also gives us a wealth of valuable data, not tied to an individual, but across our workforce on the general health of our employees. If participants follow up the wellness assessment by completing an individual action plan, they earn gold. Individual action plans are 6 to 12 weeks long and focus on tasks like quitting smoking or doing regular exercise or managing weight or taking steps to prevent or control diabetes. As I said, if someone chooses not to do anything, they stay at the bronze level. You can see on this slide that just as there are financial incentives to choose the higher quality, low cost group health, there's also financial incentive to participate in the Healthy Incentives Program, and those incentives are healthy in themselves. Bronze status means higher deductibles and co-pays. The difference between participation and non-participation can be as much as $1,500 for a family. The financial incentives prompt high participation in the program. You can see gold on the far left. Participation has been, in the total program, has been 90, 92, 93% every year. I want to address the employees who, this little group here, who are stuck at the bronze level. Who is this 7% who just didn't get it in gear? Well, even though this represents a small part of our workforce, we are making special efforts to reach out to them, to identify them, and to get them engaged. We have a commitment to equity and social justice that permeates everything we do in King County. Martin Luther King County, by the way. It is a pillar of our strategic plan. And in this case, we looked at who stayed at the bronze level, and we saw that many had blue-collar jobs, others spoke a language other than English in the home, and a third group worked in isolated settings like transit operators. So we've worked with the unions and managers for our transit operators and for our custodians to make the program more accessible to their employees, to their members. Our initial effort caused people to move out of the bronze category, and you can see that in the reduction in bronze in the far right side of the bronze group just in the last year. This year we have an even more comprehensive effort that rewards transit employees. This is a way to get people who are in isolated settings engaged. Rewards them with gold if they take on the responsibility of coaching their peers, their colleagues, through the program. We are hopeful this is going to lead to an even greater increase in program participation. Now, besides the financial incentive, the environment that surrounds our employees is a powerful motivator to get and stay healthy. Over time, we've diversified our plans to meet people where they are. We offer ways for people who are healthy to get credit for what they are already doing. And we have established intensive diabetes prevention programs for those who are pre-diabetic. One of my original frustrations with the program was that there's just a lot of online work involved. I felt that some people like me, were spending too much time at their computers reporting activity instead of actually doing the activity. So we added more workshops, and we are now able to text in what we have done, so I can report my ski trip or my healthy eating habits by sending a text. In addition to the individual action plans, we offer people an incentive. We offer people to earn the incentive. We create a culture of health. And here are some of the things that we're offering our employees. A gym discount program, Weight Watchers at work, online or in community meetings. Healthy options in our vending machines, only marginally popular. Well, this is great. So some of our unions actually owned the vending machines in their shops, and they didn't want to lose the money by having, you know, like apples and popcorn in the machines. They wanted the good stuff. So that was a negotiating point. Consumer education campaigns, on-site flu shots, and on-site activity centers. And these are not extravagant enough to be called a gym, but they are on-site. And they have basic equipment and are free to our employees to use for a wide range of exercise, including Zumba, yoga, salsa, Tai Chi, and other things that I do not do. And there are big and well-used bike rooms and showers and so forth. We really do everything we can to make it easy for people to engage in healthy habits. As members of our community, our employees also benefit from our community health promotions conducted by the county's outstanding public health department. And this gives a snapshot of the obesity prevention initiatives we have and how far the community, how far into the community they've permeated. One example I'll talk about is the community planning guidelines. Part of my academic background is a graduate degree in urban planning, and I'm very interested in how people's lives are influenced by the way in which we build our communities. The planning guidelines take into consideration things like people's proximity to parks, or the available transit connections to urban hubs, or the ease of access to grocery stores, particularly those that sell fresh produce. And this one gives you a snapshot of our work tackling tobacco use in King County. About the same time Healthy Incentives started, that's our wellness program, the state passed a law prohibiting smoking in any public building or within 25 feet of a building entrance, as building open to the public, not just government buildings. So our community is becoming less welcoming of smokers at the same time we start offering tobacco cessation programs free of charge to our employees. And the combination of these two factors is what has helped us achieve a 40% reduction in the number of county employees who smoke. So I'm going to talk a little while about this slide. This is really what is meaningful about the statistics. We have supported people in changing their lives. These are just a few of our health heroes. Let's start at the top left with the two guys. We have some coworkers from our emergency management division who bike to work together. Next to them, the larger picture, is a woman who lost 100 pounds and now hikes on the weekends with her kids instead of sitting and watching television. At the top right is a district court judge who encouraged employees to jog with her before work and gave employees permission to come in with wet hair after the lunch break. That policy has not yet been adopted in the executive office. The people in the snow are three coworkers from our environmental labs who trained together to climb Mount Rainier. One of them lost weight by telling himself, "I'm not taking that extra weight all the way up the mountain with me." At bottom center is a bus driver who quit smoking. She said quitting smoking actually helped her be a safer driver because she wasn't so concerned about rushing through her route so she could get to the break so she could have a smoke. And at the bottom left, we see a triathlete who has helped his coworkers train for our Parks Department's 5K run. So we have significant success supporting people in quitting smoking. Our smoking rate, as I said, has dropped 5 percentage points from 12% to 7%, and it's lower than national and state averages. That translates into roughly 800 people who are no longer smoking. And I have to say, people mentioned in the prior session about how rewarding it is not just to look at the statistics, but to talk to individuals. And I've had employees come up to me and say, you know, for years or decades, I've been trying to quit, or I've been trying to get my husband to quit, and we just haven't been able to do it. And the fact that the county has provided free of charge these smoking cessation programs finally made the difference, and I have hope that I'm going to live a much longer and healthier life because of it. We offer free tobacco cessation program, as I said, for those who want to quit, and it's 100% paid by the county. And people can complete this as an individual action plan so they can move up to that gold level, which means they're going to be paying less for their health insurance. We've had significant success also with weight loss. So this chart shows the bottom line is our 10,432 members that we followed who participated in healthy incentives for 5 years. They lost 4.5 tons. This despite the fact that we've laid off many of our younger, fitter employees. When compared to the National Control Group, which is the sadly escalating line, we have actually separated ourselves from where we would otherwise have been by a full 24 tons, which is a happy commentary on our program and a sad commentary on what's going on in the larger society, which of course brings home again the importance of this conversation about community health, because that's where I think all of us in this room need to be looking to tackle the challenges of this century. Even more interesting than the amount of weight lost is who benefited from our program. Women benefit more than men. 20-somethings don't benefit at all because they don't listen to anyone, apparently. African Americans benefit most of all. College graduates benefit less. We're looking into why that is, perhaps because they're more fit, perhaps because they're more solitary and don't respond as well to the kind of group reinforcement that Weight Watchers at work offers. Just like the Zumba, I will not be going to Weight Watchers at work, okay? I'm not getting in front of my coworkers and getting weighed. But people do it, and it's working. The study we did of these results was published, and we're very proud of this, in November a year ago in the Journal of Occupational and Environmental Medicine. It was the first study of its kind to find a significant weight loss benefits for a large percentage of employees over a multi-year period. Along the way, we have learned these lessons. As I mentioned, collaboration with organized labor is critical. With a workforce that is 85% or more represented, Caroline, you gave me the number 85%. I can count on 2 hands the people who are not represented. It's like me, you, and some interns, pretty much it. But we couldn't have done this without those employee groups really getting engaged and understanding the challenge and convincing their members, because they're elected officials too, convincing their members of the value of coming along. We have to communicate a lot. We spent the year before we launched the program educating our employees about the need for the program and have continued to report our results on a regular basis. We need to continuously improve, and we use the data to guide us in that. We analyze claims data and health risk assessment data. We also do a regular employee survey to test attitudes and engagement strategies, and we have plans for the future. Employees enrolled in group health who have diabetes can now earn lower out-of-pocket expenses by working directly with their doctor to manage their diabetes. Promoting the direct relationship between the patient and the physician is the most effective way to manage chronic conditions, and we want to see more of it. Next year, we will launch a comprehensive stress management campaign. By the way, this, as the executive, is the thing that our healthy incentives people always recommend for me, and I always tell them, no, I'll do the exercise more thing instead. But apparently next year I'm going to be required to chill out. Is that right? Okay. It's going to address everything from individual stress management to improving management skills and ways to reduce stress. And finally, we'll be moving more aggressively into the mobile space. And I mentioned earlier our texting program. This month we issued an RFP for a new total health management vendor. A key component of the evaluation will be how we can integrate the mobile apps that, a lot of our folks are currently using to manage their health into our incentive structure. So King County is recognized as the most forward-looking and effective purchaser of health care in our market. The partnership to reduce costs and improve wellness demonstrates that county employee health and county fiscal health go hand in hand. We developed a well-considered, game-changing strategy, and we are now purchasing health care according to objective measures of quality. So I'm anxious to take our journey to the next step, when we will have in hand, thanks to the Puget Sound Health Alliance's efforts, cost data, coupled with existing quality metrics. Then, finally, with all the other sectors of our economy, we will know for sure how to get value. So take a look around this room and consider the purchasing power that sits here. Let's leave this conference with a commitment to one another, that together we can reduce unwarranted variation in outcomes and prices by selecting plans that reward providers and patients for choosing value. So I want to thank you for having me. Caroline Whalen, the King County's Chief Administrative Officer, will be staying for the rest of the conference. Caroline, as was mentioned, is also the new chair of the Puget Sound Health Alliance, so I encourage you to track her down and to bend her ear. And I fully expect her to come back to Seattle with a plan of action for tackling and measuring presenteeism, so that you'll invite me back during my second term in office to tell you about all the money we've saved as a result, assuming I survive whatever physical stunts are required of me during this upcoming campaign. So I want to thank you very much for your invitation and your attention today. This is the customary final slide that has a whole bunch of contact information for you, some quick links and references we make available to help others learn from our experience. Good luck. Have a great rest of the conference, and I appreciate the opportunity to share with you today. Thank you very much. And I thought, since we have a little bit of time, that I'd invite Caroline up here, and we would take a few questions, and she can help me or replace me in answering those questions. And I think you have a roving mic or two. Is that right?
Yeah, we do.
Okay.
So questions right up here. Someone in the blue shirt. Right. And please introduce yourself before you ask the question.
Testing. Great presentation. Thank you very much. Just a couple of questions. The first being about whether or not you validated that weight loss and smoking cessation really occurred. And the second, if those were self-report measures or measured measures. And the second question is, would you say that the improvements occurred because of the health promotion programs that you had, or were you able to analyze whether or not the change in plan design was really a major factor as well?
So it is our wellness assessment. We don't call it a health risk assessment because we did focus group work with our employees, and wellness assessment resonated a lot more. So people self-report, but we do have evidence to support that self-reported information. So we actually have been buying uniforms that are smaller. That's one key measure, right? One of the unions reported that they no longer had to buy size 4X, so that's significant. And the Journal of Occupational Medicine has the strong validated information about our weight loss. So we know that the self-reported information has been validated. We also have done an analysis of our medical claims, and we've been able to see that there's a reduction in respiratory disease, as Executive Constantine mentioned. So we do have a lengthy report that demonstrates the health improvements as well as the cost savings, and it's on the website that was listed in the program. So I invite you to investigate it. Did I answer all your questions? No.
Question about the plan design?
Right. I think the plan design really is what got people to participate. And so we're rewarding people for participation, not for changed behavior. So in order to get the gold, you don't have to quit smoking, but you have to try to quit smoking. And I know that that is what drove the 90% participation in the first year. We were shocked. I mean, we had a lottery, not official, but I was thinking, maybe 60% of the people would participate. We had 90% in that first year. And I think because you have to do that follow-up action for 10 weeks, 6 to 12 weeks, that people got, into it. And there was such a buzz in the workplace. At first it was, oh my gosh, I'm going to do this thing. And not only did you have to do it as an employee, but your spouse, domestic partner had to do it. So for Dow to earn gold, he has to get Shirley to participate. I have to get my husband, Jerry, to participate. And let me tell you, we communicated a full year before we asked people to do anything. And when I came home and I said, you know, honey, in order for us to, get the same benefits we get now, you're going to have to do this health risk assessment. And then you're going to have to do something like finally lose weight. And he said, so when is Big Brother moving into our house? And I said, January 2006. Would you help me get the guest room ready for him?
Good afternoon. My name is LaVon Palma Davis with the University of Michigan. I wondered if you could share a little bit more about your diabetes prevention and control program. How does it work?
First of all, go Wolverines, and second, why don't you answer that?
Okay. So we have lots of different approaches to diabetes. The program that we just launched this year is in partnership with United and with Safeway and the YMCA. So we have two programs. One is a diabetes prevention program, and the other is diabetes control program. And we did free diabetes assessment, and we put people into the two different groups. And for the prevention program, for people who sign up to do it, they get a year's free membership at a YMCA. And for people in the control group, they have free access to counseling at Safeway. For people who are in our HMO plan, group health, they get credit for working with their doctor directly. So, and we also, all our programs to Eat Smart, Move More, we know that that helps to prevent diabetes.
Hi, I'm Carl Faddis from Eugene, Oregon. I'm a bus driver and a union member. Go Ducks.
That's painful. That's painful for a Husky.
All right.
That's
I'm
painful.
an LSU Tiger first, okay?
Okay.
So with respect to stress management, there are these kinds of Band-Aid sort of adjuncts that we can come up with. At our workplace, we're finding that there are a number of our work environment is filled with sort of policies and working conditions we're bus drivers, so our work life is really pretty tough. And we're finding a real disconnect between what management's experience seems to be about what we do and what we actually do. And those kinds of schizophrenic policies and the relationships that we have with road supervisors and all of, tight schedules, things that you're not, that you're obviously familiar with. Mm-hmm. I guess the question is, you can come up with these, are you coming up with these sort of Band-Aid kinds of, let's give you a chance to lotus blossom, or can we really deal with the underlying reasons about why you're, really feeling that kind of stress? And we are really looking for ways, I'm the executive board officer, so we're really looking for ways that we can fit, where I can co-endorse with management to support the same goals to reduce stress and improve our lives. And so I appreciate so much your efforts and obviously results with working with labor to do that.
So thank you for the question. What you're getting at is the nature of the partnership. It's not just a partnership to have our employees do what management wants. It's management listening and finding out what it is that's causing these adverse health conditions with our workers. And we work very closely with ATU, our locals 587, which is the largest employee group in our county. We have a very large bus system. And we are working on approaches that are successful for the particular challenges those drivers are facing. At the same time, we have challenges that are exacerbating some of those problems that the bus drivers face, like having to tighten our schedules because of a shrinking budget, trying to keep the buses on the road. How much layover time do you have? Do you have time to get something decent to eat? Do you have time to visit the restroom? Do you have time to brush your teeth? It's an enormous challenge. And one of the ways in which we're trying to address that is by having these employee peer groups, the peer-to-peer, not counseling, but coaching to really help people find the right way to engage this program to save money on their premiums and to get healthier. But it's right, it's bigger than just our healthcare plan. It's about working conditions. It's about making sure that we are identifying what's going wrong for a particular employee group, particular type of injury or malady, and what in their work life can be changed to avoid that. Thank you. And there's a little more on that.
Let me just say one more thing about that. So we work really hard with our different unions, and Executive Constantine talked about breaking the bronze barrier. We really want to know why people aren't participating. So we've spent a lot of time talking with our bus drivers, and one of the things that we've done this year is we have Road to Gold. So they actually branded their own healthy incentive program for their membership. And things like 5-minute stress reduction techniques, we have bus drivers teaching other bus drivers how to do that. And evidence has shown that as little as 10 minutes a day of deep breathing and centering and focusing can really help reduce stress, especially before you get on your route and maybe at the end of your route.
Last question, and then Dow needs to get to the airport.
This might be a little bit of just digging deeper into that other question, talking about some of those groups that can be difficult to reach, even with incentives. So you mentioned diversity and equity. Certainly drivers would fall into that category, but let's talk about some of the folks that have language barriers or cultural barriers. Can you speak a little bit to some of the strategies that you have or are planning to employ to engage those groups, and how they can feel a part of the bigger initiative within the county?
And I will let Caroline address what we're doing inside of our employee family about that. But I just want to reiterate that within King County, we take very seriously our the imperative to promote equity and social justice. And what we've done is, instead of sticking in an office in the corner, we have made it central to our strategic plan and a part of our decision-making every day. So anything that comes before me, in addition to an analysis of the fiscal impact, for example, there's an analysis of the equity and social justice impact. What will this decision do to people who are disempowered? What will this decision do to people who have less political leverage? And you know, in our community-wide work, I mean, King County has the most diverse zip code in the nation in it. We have this excellent public health department that is very well equipped to reach out to communities, speak over 100 different languages in the home to try to meet people where they are rather than try to force them into a system that they don't understand and that may not fit their expectations, to meet them where they are and to try to get them engaged in these simple lifestyle choices that are ultimately going to lead to better community-wide health. Could you talk about our efforts with our own employees?
Sure. So we really make an effort to help create an environment where all people thrive. You know, not only our employees, but their family members and the community at large. So we do things that are interactive. We do have these modest activity centers, and we encourage employees to form their own interest groups and exercise around it. So we have Tai Chi. We have a large Chinese population in our community. We have Zumba. We have kickboxing. We also meet employees where they are. So we have a lot of shift workers, custodians that work in isolation. A lot of them speak English as a second language. They have their meetings, their union meetings at about 2:30 in the afternoon. And so we make speakers available to them. We have coaches for them. We have help with online. We've also talked to the employees and worked with interpreters, and find that many people who speak English as a second language have children who speak probably better English than I do. And so what they've assured us is that they're getting the help that they need at home, or they feel like they can get the help that they need in the workplace. But we do everything we can to support our employees and break that bronze barrier. But I'm here to learn also from what you've done, because I know that there are a lot of innovators in the audience today.
Thank you, Sal. I really appreciate it. Thank you. Thank you.
Hey, please join me in thanking Carolyn Whalen and Dow Constantine. Dow, we appreciate so much. We know how busy you are. Get back to King County and do...
I'm going to get the 5 minutes of stress reduction in my day.
There we go. And Carolyn, thank you for staying around. Carolyn Whalen will be here the next couple of days, so you'll have an opportunity to interact with her. So again, we are just so appreciative and privileged by you participating, both of you today. So with that, we're making an immediate transition. Don't leave the room. And let me give you Tom Perry. Tom, it's all yours.